The first thing I wish to do is to join with colleagues in expressing my condolences to the families of all of those who have lost loved ones as a result of COVID-19 since we last met in this House. And I particularly want to join with my colleague from the constituency of Louth, Deputy O'Murricu, in extending my sympathies to the families of those who have lost their lives in Delgan. And I would appreciate it if the Minister may share his views, the views that he receives back from the HSE when he makes those inquiries with colleagues in the Louth and East Meath Dáil constituency. I think that would be very, very useful indeed, and I'm happy to work with Deputy O'Murricu and others to try to resolve some of those issues in the public interest and the interest of those who have lost loved ones, and as well in the interest, of course, of transparency. And that's the next issue that I wish to raise with you, Minister. The first thing I want to ask you in the context of the questions that I seek to put to you is to publish the letters written to you and your department by the HSE Chair and Chief Executive on the 19th and 21st of April. We in the Labour Party and my party leader Alan Kelly understands that these letters point to issues around testing, the testing regime and wider governance issues. At the moment, Minister, and I think you would accept, and I know this House would accept, that this Parliament functions in a very restricted fashion. It is virtually toothless at this moment in time. Therefore, never before has it been more important for our ministers and public officials to behave transparently and with absolute frankness and candour. And I think you have to front up, Minister, and respond to Deputy Kelly's demands that these letters be published openly and made available. And I want to ask you when you intend to do that. Minister, when Vicky Phelan speaks, I think we all should listen, and I listened very intently to what Vicky had to say on the News at 1 today. She has urged anybody with symptoms that might be associated with cancer and other very serious conditions to access the health service, to make contact with their GP and so on. And I want to add my voice to that call. I am worried, though, and other colleagues have expressed their anxieties here in this chamber this afternoon, that some health services are running, others are in what we might describe as sleep mode at this moment in time. Minister, we have a roadmap to open up hair salons and tattoo parlours, services which I have little need for myself. But none exists in terms of a roadmap to reopen our health service. And I think we are in danger now, as many colleagues have expressed, of non-COVID, possibly avoidable deaths surpassing COVID deaths, and that should be a cause of real anxiety for everyone. And where, Minister, is the roadmap at for the reopening of our entire health service? I want that to be made publicly available, a roadmap that will point us in the direction of when full cancer services will be open, when critical care services across the sector will be open, community services and others. That is going to be really, really important. And Minister, will it be you, as the Minister responsible for our health service, who will ultimately make that decision and ultimately make that call with the HSE, or will that decision be subcontracted out to NEFIT? Can you elaborate on your role on this when you have the opportunity? Are you in charge of this decision? Are you in charge of making it, or will that be subcontracted out to Dr Hoolan? Who makes the final call? Is it you, Minister, with the HSE, or is it NEFIT? I am troubled by the fact that we don't appear to have a publicly available roadmap for the reintroduction of full breast check services, cervical screening services and bowel screening services. When will they fully return? Can you inform the House? And can you let the House know the percentage of patients who were screened pre the shutdown who have yet to receive their results from the screening programme? This is going to be very important, and every single day, as you know, Minister, matters when you are awaiting results for cancer screening. On HPV screening, that was meant to commence very shortly. You might elaborate to the House when this very critical system will be introduced and when it will be made available. I want to just continue on with some of the remarks made by Deputy Feehan earlier on in relation to our dental service. I too have been contacted, as many colleagues have across the House, by local dentists who are by and large private operators who are very concerned about the situation that they're in at the moment. They're concerned as well, and they've provided me with reports on the ground that the kind of emergency services the HSE said would be available aren't in fact available in all cases. And I have had reports of cases arising in Drogheda and in Dundalk where people have not been able to access those emergency services. And the real concern is that as those dental issues become more problematic, we could have cases where people are referred to our hospitals instead of being cared for in the community by our professional dentists. So I'd be very interested to hear the outcome of your meeting with the Irish Dental Association tomorrow. Just in conclusion, 2 further points, if I may, and it's just in relation to face masks. Minister, why do you appear to be flip-flopping in relation to the idea of face coverings? I mean, we have countries like Slovakia, a similar size to Ireland, with a very low number of COVID-19 deaths, where people have been required to wear face coverings, I think, since the end of March. Now, there may be no causal relationship, but I think we have to take the precautionary principle and ensure that people are safe. And my own view is that, based on the evidence I have read and has been communicated in the public media, there is a very strong argument for very strong advice emanating from government to encourage people, and indeed potentially to make it compulsory for people to wear face coverings, particularly in public transport and in the context too of shops and so on. Minister, just finally, it was raised by Deputy O'Reilly earlier on, the position of Section 39 organisations is dire. There's a perfect storm that's emerged here. Funding cuts by your own department in the context of the 2020 HSE service plan. Will you restore the level of funding to the Section 29 organisations and revoke that 1% cut, which is in effect a €20 million cut to those agencies? And will you also set up, as Deputy O'Reilly appealed for, a COVID-19 fund to ensure that those organisations in critical work in our community are properly resourced? And can I ask you just finally, and Deputy Ledden mentioned the app and contract tracing and the interaction between the North and the South. Why, Minister, and it baffles me, why did you decide not to include non-residents in terms of the travel restrictions that you introduced a number of weeks ago? There are huge concerns in North Louth and in other border areas about this particular issue. We are all working really, really hard to abide by and comply with the public health restrictions around travelling, but there's nothing preventing somebody from the North coming down here, somebody who's non-resident, and spending as much time as they like down here without any interventions whatsoever from the authorities. I wrote to you about this last Monday week. This is a serious issue. I've had reports, for example, of families from the north coming down south in North Louth to spend weekends with their family. Whereas, we have grandparents in the Cooley area who've got grandkids in Dublin who haven't seen them for weeks. It is deeply unfair. Minister, are you going to revise this situation? I'd be interested to hear what you have to say.
Thanks, Deputy Nash. Minister, to respond.
There's a lot of questions. 2 minutes, 7 seconds. I'll do my best. In relation to Delgan, yes, I'll certainly keep all the deputies from the constituency of Louth informed, Deputy Nash, and we'll work through it on a cross-party basis. Yes, I want full transparency, no difficulty those letters being published. Just to be very clear, though, on this, because I think this could just make life easier for everybody. And the National Public Health Emergency Team contains the HSE, the Department of Health, HIQA and the HPRA. It is chaired by the Chief Medical Officer, but it is not just an organ of the Department of Health. It has on it senior representatives from the HSE. It brings together everybody and it makes recommendations. And it's right that it does on what is an appropriate level of testing, for example, to do. I'd far rather they were doing it than me, as it happens in other jurisdictions where it becomes political. Obviously, those decisions then have to be operationalised. And it's perfectly appropriate for the HSE to say, how do we make this happen and what's the time frame? And there is now an agreed plan, a trajectory, and we're beginning to see the benefits of that. You raise a very important issue, Deputy Nash, in relation to the roadmap for non-COVID care and regular health services, and I share your view on it. To be very clear, though, the national roadmap does say that from the 18th of May, in phase 1, we talk about the resumption of these services. Who makes the decision? Well, ultimately, the operation of the health service is for the HSE, but it will require the input of NEFIT, because I'll tell you this, we can't go back as long as the virus is here to the old way of providing the health service. Trolleys, lethal. Packed outpatient appointments, we can't have that. The use of PPE, so it will require the input of the National Public Health Emergency Team in terms of how you safely do it. Same with the turning on of the screening programme. I share your concern in relation to that, but the timing as to when that's safe to do will be done with the National Cancer Control Programme with the input of NEFIT. In relation to the screening results question, I truthfully don't have those figures, so I'll come back to you on it. The dental services, I take the point you make. Meeting them tomorrow, we'll revert to you after. Face covering, no flip-flopping in relation to that. It absolutely will be a part will be a part, but NEFIT is going to work out how best to do it, in what scenarios and what guidance, because inappropriate use of Cathaoirleach could actually be dangerous. Section 39s, I think we have to be honest, that 1% cut isn't going to be achievable. I take that we're in a very different world now, and I'll engage with the sector on that, and I'll come back to you on the regulations.
Deputy Roisin Short.